right, good evening. Welcome to the Coronavirus Update Show. My name is Omari Salisbury. I got to get my name right. Omari Salisbury, and I'm joined by producer extraordinaire, Nikki Barron. What's up, Nikki?
Hey, how's it going?
I'm good. I still say, man, you got the hottest home studio in the business, man. I got to get my crib set up like yours, man. I don't think I'd ever leave home.
Yeah, and recently started working on the second bedroom to turn it into a studio space. So hopefully it'll just keep getting better and better.
Look at you. Well, it's been some days since we last checked in on the Coronavirus Update Show. That was last Wednesday, and today is Monday. So as usual, let's get to the numbers.
Yeah, absolutely. Let me get this dashboard up here for you. So we have, let's see, a total number of diagnoses right now just at 354,782 cases, including 5,174 deaths, according to the State Department of Health. We've hit 20,082 people that have been hospitalized in Washington due to the virus. And we're sitting at an 81.9% hospital capacity rate. And we've actually been hovering at that number, if you tune in frequently, for weeks now, months really. And that's kind of alarming because we're not supposed to really get over 80% if we want to make sure our hospitals are not overwhelmed. So hopefully, ideally we would hear that this number was going down, but we just keep seeing that it is just staying right there. And yeah, we just hit 2.6 million Washingtonians that have been vaccinated. So yeah, the numbers are looking worse than they were the last couple of weeks, but not like, oh gosh, everything terrible is happening. So,
Boy, man, is there any good news you have?
It's not really good news. I mean, we'll get to some because I think the new vaccine eligibility that we're going to get into in a minute is pretty good news. But yeah, in King County, we've been experiencing a dip in the COVID-19 spread up until about 2 weeks ago. And that's when we started to see an increase. So since 2 weeks ago, we've had an 18% increase in cases, especially for people in their 20s and 30s. And the data is showing that this increase in outbreaks is actually coming from predominantly from restaurants, bars, and travel, which isn't the best news considering that we're, moving into the next phase.
Yeah, I was getting ready to say, wow. So an 18% increase over the last 2 weeks, the majority of people in their 20s and 30s, and it's coming from restaurants, bars, and travel.
Yes. And as of today, we're actually officially in the phase 3 of the Healthy Washington Roadmap to Recovery plan. So in this phase, we're going to see 50% capacity on indoor activities, which is, bars, restaurants, gyms, bowling alleys, things like that. Bars and restaurants can now stay open until midnight, and large events like graduations and sporting events are going to be allowed in limited capacities. So, and on top of all of that, the governor did also sign a proclamation requiring in-person education for public schools K through 12. So although we're kind of getting those vaccination numbers are getting a lot higher and we're vaccinating at a higher rate, we are seeing an increase in community spread. So it is kind of alarming. It's kind of like a yay, we're opening up, but also we are getting more cases, which happens every time we open up, and it feels like we're kind of at the finish line. So we'll see what happens.
2.6 million Washingtonians vaccinated. That's over 30% of the population of the state of Washington. So that's
the first vaccination, I believe. So there's probably still a good chunk that need to get that second vaccination.
Right. And so it also maybe seems like a race between the vaccination and the opening up.
That's exactly what it seems to be, is that the governor is doing them at the same time, opening up and also opening up who can get the vaccine. I'm sure a lot of people have heard the rumors of, people are, just happen to be in the Walgreens at the right time and they get their vaccine because they have extras and they're about to close and they have a certain amount to give out every day. Stories like that. So it is looking like it is more accessible to get vaccines, and the number of vaccines that we're getting from the federal government is increasing. So it is sort of a race against time of if we can get the vaccine before the hospitalizations get too out of control and deaths continue to rise.
Right now, speaking of vaccine, there's a new phase that we're in, right? Or a new eligibility.
Yeah, so we're currently in phase 1. Hold on, sorry, I want to make sure I get these right. They've gotten so confusing. So we're actually currently in phase 1B, tier 2 of the vaccine distribution, and we're moving into the next 2 phases. So they're kind of pulling those 2 phases in, and those start in on March 31st. So the new phase of this vaccine eligibility includes everyone from all the previous tiers. Plus, they're going to be adding in restaurant workers, anyone with 2 or more comorbidities, Washingtonians that are 60 and older, as well as anyone living and working in a congregate setting, which brings the total number of eligible Washingtonians to about 5 million. And for anybody who doesn't know what a comorbidity is, because that's kind of I feel like it's an insider baseball term, I wanted to talk about what that is. And they get these comorbidities from the CDC. So the CDC guidelines on what a comorbidity is if you have cancer, chronic kidney disease, COPD, which is chronic obstructive pulmonary disease, Down syndrome, heart conditions such as heart failure, coronary artery disease, or cardiomyopathies. If you have an immunocompromised state, like a weakened immune system from organ transplant or medications that compromise your immune system. Also obesity, and then they wrote severe obesity, which is twice. I got this straight from the King County website. It's also pregnancy, sickle cell disease, smoking, and type 2 diabetes. And I thought this was kind of an interesting one because you're supposed to have 2 of these but I mean, those are pretty severe. And I also saw a lot of respiratory diseases that aren't on here. COPD was there, but asthma's not on there, things like that. So it's really interesting. And you have to have 2 to qualify.
I didn't see anything on there that said burnt out member of media.
That is definitely a comorbidity that should be included on this. I know that recently a lot of groups have been coming out trying to get journalists added to this because we are frontline and essential, especially the reporters that are going into these COVID wards and taking photos and reporting directly on what they see. It's pretty crazy that they don't have, they're not being included, but we'll see what happens.
Yeah. All right. And so I saw that we reported when Seattle Mayor Jenny Durkan extended the rent moratorium here in Seattle. Then it looks like Governor Inslee followed that back up for the whole state of Washington.
Yeah, he did. So if you guys watched, this was all in one press conference. So, but last week, the Governor Jay Inslee announced that the statewide eviction moratorium is going to be extended through June 30th. And since the beginning of the pandemic, most renters have been able to hold onto their housing in Washington state, whether or not they've had the ability to pay. So it's been about a little over a year now since they first put that moratorium in place. And then in regards to Seattle specifically, there is an additional mayor's moratorium that was extended to the same date just a couple days before Governor Jay Inslee. But yeah, it's kind of interesting because it makes sense that we're going to have these moratoriums because studies are showing that policies that limit evictions do reduce COVID-19 infections by 3.8%, and it actually helps reduce deaths in communities by 11%. So not having people have to seek shelter with friends and other family members or look for shelter through the city or the county, it does help save lives. But I mean, we are in a pretty sticky situation. I mean, nationwide, we have over 10 million people who've reported that they are behind on rent due to the coronavirus.
That's a lot of people.
It's a lot of people, yeah.
Man, they talk about this eviction tsunami that might not happen everywhere in the country, but definitely some parts of America, it's going to be a lot of evictions.
Definitely. Yeah. And I mean, there are some safety nets in place, and there have been funding put in place for renters. But I mean, it's a really interesting situation. It really puts community members against each other. Landlords, versus tenants in a really sticky situation. So just to break down the moratorium, statewide, these moratoriums, they ban people not just from evictions, but it also bans them from putting in late fees. So that's one big thing. And then right now, the only way in the state of Washington that you can evict somebody is if you're selling the home or if you have a health and safety claim. But if you're in the city of Seattle, you can't sell the home if you have a renter in it. So the only way to get somebody out would be through a health and safety claim. So, if renters are unable to pay after the moratorium, the mayor's office in their press release did say that there would be a path to resolution for those who could demonstrate financial hardship, but they didn't really talk much about the specifics of what that might look like. So really the only thing I found is after these moratoriums are lifted, there is in the city of Seattle anyway, there was a bill that passed city council proposed by President Lorena Gonzalez that puts a 6-month kind of extension, I guess you could say, but it actually would just require that landlords and tenants have to try to find a resolution through a payment plan before they can move forward with that eviction. So there is that sort of 6-month cushion on top of it. But if you're a resident who has received an eviction notice during the moratorium, the city of Seattle and the state of Washington are urging people to reach out to the Renting in Seattle hotline at 206-684-5700. So it's got its pros and cons.
Yeah, this is gonna be an interesting time. I will say this, that it looks like in general, maybe we're finally moving past the worst of COVID in the biggest sense. At least here, I don't know about Miami Beach, but
Yeah.
but at least here we are. You got anything else for us today?
Yeah, I wanted to talk a little bit more about the landlords in this situation, just because I feel that in the coverage that I've seen, it doesn't really talk about it from both sides. And I think it's important for people, renters, to understand that your landlord is likely a small business owner, local in your community, that is not just trying to evict everybody and has no heart about COVID, but they're actually like a person with their own COVID struggles. And it's important to remember that small landlords are an integral part of offering affordable housing. Small landlords own over half of the national rental units. So that's people who own 9 or less units. And they actually typically cost less, according to a Harvard Joint Center on Housing study. So if we don't support landlords, and there's not much federal aid for landlords or local or even county level aid, we're going to see a huge drop in affordable housing because the landlords will be forced to sell because they cannot continue to hold these properties because they're not getting any rent and they're not getting any help from the government. The only thing I found was that King County did have a lottery assistance program for landlords that ended in December, but there wasn't actually that much financial help in there either, and it was very restrictive. There was a lot of things you had to do to qualify to get it. So really, other than that, I haven't seen anything for our local landlords. And so it's, kind of what I said earlier, it's really pitting landlords against tenants, because now landlords are setting up computers in their lobbies trying to get tenants to come and apply for this aid so that the aid goes to the tenant and that money can flow to the landlord. Landlords are, they really are going to be left chasing tenants that that never reach out to do a payment plan. They just up and leave one day and never pay that back, a year's rent. Some landlords are saying they're out $30,000 in revenues. And the average landlord in the city of Seattle only makes $75,000 a year. And 43% of those actually make less than $50,000 a year. So I think there's a misconception about who's a landlord. And even the name landlord is really silly, like they're the lord of the land. But they're real people. And there's a lot of empathy and I think a lot of media attention going on renters, as they should be, because they do have a worse situation as somebody who could just pull the rug out under them. But also, like, don't leave your landlord hanging if you haven't paid rent for a year. Like, actually engage in those programs to get payment plans, because it's, the more I understand, like, as a I hate the name landlord myself, I have an apartment in the back, and if he just didn't pay for a year, that would be, pretty like breaking for me financially. So I definitely empathize with both sides. I was a renter not long ago, so I just thought it was important that we cover both sides of that story.
Right. So a few things that the courts here in King County, they have a payment plan situation, because what they don't want is they don't want the sheriff doing mass evictions here when these moratoriums are up. And so the King County Court actually has a program where you and your landlord work out a terms payment plan. They have basically a mediator. All these services are free for people to be able to communicate with their landlord. But also, it's like, I think it's as well the different media type coverage here in the Seattle area, because over the last year, I went and visited my dad twice in North Carolina and down south. And so many of the property owners, there's a lot of Black property owners down there. And even where I went to school, Elizabeth City and everything like that, their whole time in college, everybody owned the houses and everything else. It was people who looked like them, were part of their community, went to church with, and everything else, community events. And so it's not so much of the pitting of landlord versus tenant, in other areas of America. It's a real high intensity more here in the Seattle area than I've seen in some other parts of the country, where at least in my community, a lot of the landlords or the property owners are people that we actually know and or grew up with, or our parents know, and things like that. And so it's easier to have a lot more empathy with their plight. We don't necessarily see that as much here.
Definitely. And I think it's important to note that even in the program that you mentioned, if you go back to a previous episode, we actually interviewed one of the judges who's a part of this program. And I would say at least 99% of the programs that are available that could benefit landlords have to be initiated by the tenant. The tenant has to initiate the going to court to make the payment plan using that program. The landlord has to get them to actually do that. That's the difference. So I understand the fear of mass evictions, but all the programs that can keep mass evictions from happening have to be initiated by the tenant. And if tenants are not communicating with their landlords about what's happening, we're really going to be doing damage to the affordable housing across the country. Like I said, half of the housing units in the United States are owned by small landlords, and they are significantly lower cost than corporations. So let's make sure that we keep that integral part of affordable housing, part of Seattle, and like take care of each other, like understand your landlord's a person. Maybe we we make up our own term instead of landlord, because we're not like lords and ladies around here. You know what I mean? We're just regular people who, aren't, doing it. But yeah, we're just, the coverage has been really interesting. And I've definitely, heard a lot of stories from other news organizations where landlords are not, they have stopped hearing from their tenants, which I understand, because it must be extremely stressful to like every month be like, I don't have it again. I don't have the money. But let's stay in contact with each other. Communication, as you say, all things are possible through communication.
This is true. Even in crisis, especially in crisis. All right. Well, anything else for us?
That's all I've got for us. A little bit of bad, a little bit of good.
That's all you got for us, huh? All right, good stuff. So we're back on Wednesday at 6:15, huh?
Yeah. And I guess another announcement is starting tomorrow in the 7 o'clock hour, you can actually catch the replay of the coronavirus update show on KBCS. So if you missed part of this, or if you're a really early morning person, maybe you have a commute again, you can catch us on Tuesdays and Thursdays in the 7 o'clock hour. KBCS.
Good stuff. You know, I'm already up at that time, so
You've been up for like 3 hours at that point.
I'll make sure and tune in. All right. Well, also you can catch the morning update show tomorrow morning at 11 a.m. right here where you're watching the coronavirus update. And tell them online where they can keep up with all this.
Yeah, just hit us up at whereweconverge.com. Just navigate. You'll see the COVID-19 resources page. That's where you're going to find all our past episodes. You can find the link to the podcast version of this show, as well as a blog version where I dive even deeper into these topics, explaining things, giving you guys links. So go check it out, whereweconverge.com.
Good stuff. All right. Until Wednesday at 6:15, we're out of here. Peace.
Yes, peace.